Warm greetings. This is a last session, the last week of the MOOC, and it is a MOOC during which the world around us has changed for ourselves and our families. In many cases, we are working from home. We are experiencing aspects of the COVID-19 pandemic, and for others, we are preparing for it, perhaps with a sense of trepidation. But also many people, and many of you in this MOOC, will have been working extensively to try to figure out, from your professional point of view, how to ensure that the COVID pandemic does not have the heaviest burden on the poorest. So in this brief presentation, I'd like to share with you some ways in which what we've been working on in this course could be of use in the very short term. And one low-hanging fruit, as it were, for some countries that have relatively recent data are the global MPI data. And we've already covered in this course that the existing 2019 data bank covers 101 countries and 1,100 subnational regions. Furthermore, in July, we will be updating this with UNDP to have 2018 or 2019 data for 1 billion of the 5.7 billion people covered. And in many cases, these data can themselves be useful in a very rapid sense to identify some populations that are vulnerable to COVID-19. We have a briefing on our website which illustrates a little bit of how this can be used. For example, the global MPI contains 3 variables that might be of particular interest. They might be risk factors to having a big health impact from COVID-19. One is undernutrition, one is unsafe drinking water, and the other is solid cooking fuel, which is highly associated with acute respiratory infections that make the cost of getting COVID much, much deeper. And across the 5.7 billion people in 101 countries, 3.7 billion people experience at least one of these risk factors, and 472 million have all 3. But what does a multidimensional perspective add? It adds an understanding of how these deprivations overlay. So if you look at the left-hand bar chart, the height of it is 472 million people. All of those people are deprived in nutrition. Somebody in their household is undernourished, in lack of safe drinking water, and in solid cooking fuel. But notice that only about 75 million, the lightest pink stripe, only have those 3 deprivations. Nearly all of those 472 million people have other deprivations at the same time. And the deprivations in this graphic are equally weighted, so we can just see a simple count how many people only have 1 more deprivation. But so many, as you can see on the screen, have more than 5 deprivations. Another useful tool is the mapping. So this is a map of Nigeria with a population of about 200 million and roughly 100 million MPI poor people using the 2016-17 data set, which will be updated. And about 40 million of those people have all 3 of the risk factors. And they are in the red. And we see that the COVID prevalence, which are the green dots, are in the areas where as yet the COVID factors are not so intense. So there is a real need to spring into action to prevent the populations in high-risk areas from the onset of the COVID-19 virus. We can similarly do this mapping. We've done a global map, but now not looking at the level of poverty, but the number of people who have 2 conditions. They're MPI poor and they are at high risk because they experience all 3 of the COVID-19 indicators: undernutrition, lack of clean drinking water, or it's 30 minutes or more away, and lack of clean energy or cooking fuel. And again, we see that right now, as of the 8th of April, the COVID pandemic is maybe not affecting all of the countries where it may, very sadly, be increasing in the short term. So there is a need to think about how to support these. There's also a recognition that this map lacks employment. It lacks which of the households have elder household members. It does not pull out individually who has a cell phone, so could receive information just in time on emergency response packages that are coming out. So what we do in other places is to do a special analysis, looking at regions or looking at groups. With the global MPI, we are able then to identify some of these other indicators that are of interest and to look at them by regions, by certain populations, or by children or the older people. And we can, like Nigeria, do similar maps and analyses, sometimes with additional indicators at the national and subnational level as well. And again, what we are bringing to the table that the other groups involved in COVID response do not at this moment have is who has several deprivations going on at the same time, and so requires a targeted assistance rapidly. But there are some countries where the global MPI is not the right indicator, as in many upper middle income countries or some lower middle income countries. Perhaps the data are out of date, or they don't include vital indicators like employment. In that case, other data sets can be used to construct a multidimensional vulnerability index. This is not done with the consultations and the extent of policy engagement that we've been advocating for the MPI. It is a rapid exercise, but it can be done by, if the country has an MPI, extending it to include other COVID response indicators. And if it doesn't, then identifying the indicators that would be appropriate given that data set and that situation. And also disaggregating it not only in the usual way by geographic regions and political districts, but also by the presence, for example, of an elderly person or a person with underlying health conditions in the household. And if the MVI, Multidimensional Vulnerability Index, does not have the indicators that you require, you can overlay it with a map of other indicators at the same lowest geographic level that you have. For example, with monetary poverty, to see whether the same districts are among the poorest by both measures. And also, because right now we need a fast response for policy, we can run simulations of the expected impacts that different policy responses would have on MPI indicators, and so how they would affect poverty in the short term, and also of different deprivations. For example, we know sadly that school attendance is going down rapidly in some areas as schools are shut. So the use of the global MPI and of the national data sets to create a bespoke multidimensional vulnerability index are ways of using household surveys to identify vulnerable people groups and regions in order to inform the emergency and post-emergency COVID response. But in some situations, it is also necessary to generate very rapidly a targeted response where there is the infrastructure to manage that. And when countries already have existing registry or census data, and when they decide that a targeted rather than a universal response is more appropriate. A multidimensional targeting index will use indicators from the census or the registry data, and the indicators will be chosen to reflect the populations of interest in the current crisis, and it should be designed swiftly. But you also have to take great care. For example, if you know that unemployment has changed dramatically or school attendance in the last little while, then you might not use those indicators in the way that you would if you could assume that they had not changed. As ever, because we must do due diligence on any metric that is going to be used to include some people and exclude others, robustness tests should be used to ensure that the final list does not change if some parameters are adjusted. And the last intersection between multidimensional poverty and the COVID response has to do with data. Because all of this course, we have primarily focused on household survey data. But in many countries, the household surveys are paused and will not be fielded for some time. And yet data are still required to target, to monitor, and to inform policy actions. And for that reason, and very rightly, remote survey instruments are being developed that are short and rapid, and that could be implemented without face-to-face interviews, so by telephone or app in places where mobile penetration is deep. And these are already under development by different international agencies and national statistics offices. Our understanding of the importance of understanding the overlapping deprivations that pertain to poverty, and in some cases of having ways to update a household-based vulnerability index or poverty index, means that, if possible, those questionnaires should include some of the MPI indicators. It will not be possible to include them all, and we are going to have to adapt, be flexible, and experiment. But our hope is that if a lot of care and foresight is invested in these new data collection exercises, we will be a step forward in the immediate term, and also in the longer term, we will have other technologies open for going down to greater levels of disaggregation, which is often required anyway for local government responses. So in this short video, I've tried to just outline how the global MPI and national data sets, registry data, can be used during this COVID pandemic emergency response. I'd like to close only by saying that our hope is also the following. After the COVID emergency response, there will need to be a time of rebuilding. There will be a need to invest again in building up services, in training human resources, and in putting people back to work. A very strong hope is that this effort could be one that does not increase inequality yet more, but rather that is a boost for the poor, a kind of a Marshall Plan, a kind of an epoch that we will look back to and say that in the post-COVID-19 pandemic period, there was a historic and decisive inflection point, and poverty went down. We know that in the short term it is going to go up, but our hope is that through the techniques of this course and in collaboration very strongly with colleagues who work on other kinds of poverty and social protection programs, we will be able to be a part of that historic shift. And our hope finally in this MOOC is that it's brought us a few steps closer to doing that. I must say personally, on behalf of OFI, we are still very much learning, and we value this MOOC, we value the interchanges that we have had, and we very much look forward to learning from you in the next few months as well. So please do stay in touch with us and with colleagues at UNDP and share what you've done so that we can learn from one another quickly and do our work better. Thank you ever so much.